Good day to you all. My name is Sally Gill. I am a registered nurse working in a correctional protection setting in Queensland. And we're freezing, can you tell? I've been there for almost 5 years and I love it. My job is most certainly a unique one and a far cry from my hospital nursing life. The clientele we cater to is not your usual type of clientele. I came into correctional nursing as an experienced nurse, but most certainly a naive one. I've had very little exposures to prisoners previously, the odd one or two from the watch house, but that didn't entail a lot of getting to know you kind of relationships. My only comparable experience was watching Prisoner in Division 4 on telly. Nurses have been known as sisters and angels, and the characteristics of being a nurse means something. You can't become a professional nurse by accident. It takes dedication, stubbornness, and hard work. Seriously, who didn't have doubts by your second year of uni? But we access natural talents and affinities that we have learnt through life and skills and experiences. But we're also learning continuously along the way. We learn from others and we learn from their mistakes as well. My individual core values are to treat everybody the same, with empathy, understanding and compassion, as should every person that takes up nursing as a career choice. It used to be said that nursing was a calling, and I still believe this rings true. A nurse cannot be made or created if there is no compassion in their soul to start with, and life experiences teach us empathy and understanding. I've known nurses who have fallen into the profession who hate their job, and it shows. I've known nurses who have wanted to be nurses since they were young children, myself included, and it shows. The incarcerated population I deal with has a very small transient population, but the majority are classified as long-term, lifers, or at Her Majesty's pleasure, which means they'll never get out of jail. I deal with they like to be called famous, we call them high profile, pedophiles, murderers, bikies, and there are even some, only one or two, that I believe may be innocent. I've seen these same men, up to almost 900 of them, day in, day out, for almost 5 years. I've worked with female prisoners for 3 months last year, which required establishing quick rapport with a suspicious population that mistrusts all women. That builds a special kind of patient relationship, but it is a relationship of awareness and alertness as well. These are, after all, prisoners, and they are not in my specific protection prison for pinching somebody's garden flowers. They've done heinous acts and unthinkable crimes that will boggle the mind. However, these guys and gals are still human and still get sick. Sometimes self-inflicted, sometimes by circumstance. Our recent COVID outbreak brought the prison to a screeching halt, and supplying care and keeping ourselves safe was a mammoth task. Educating the officers on donning and doffing was an interesting task. Educating the prisoners that it's not just a cold, and they learnt a lot about infection control in the 10+ days that they were locked down. Providing care can be difficult at the best of times for a variety of reasons. The structured day of the correctional setting impacts often getting patients up to medical for assessments. Couple that with short staffing on correctional and health staff sides, well, some days it can be virtually impossible to get someone up to medical. And I've often had prisoners refuse to participate in care because they don't feel we should bother with them. I remind them that although I know they're in jail, it doesn't matter to me. I still want to look after them. Some are surprised, others still refuse help. Often prisoners are afraid to tell us that they are unwell because they may be seen as weak and targeted by healthier prisoners. Others have committed crimes so heinous that they are never to be released and keep up the tough guy front when they are actually aging badly and need medical assistance. Other prisoners who are healthy and go under the radar because they simply do not complain about every tiny little thing that is wrong with them often get ignored when they do speak up. Sadly, this has happened 4 times in my correctional nursing history, and each time the outcome has been tragic. This is sadly unnecessary and devastating when that prisoner has come to me finally opening up about symptoms when they've approached other nurses previously and been dismissed. I've learned it's the quiet ones you need to worry about. I recently did a chart assessment on half the population of our 126 aged and vulnerable prisoners and found 12 people slipping through the cracks. These are the ones that are older than 70 years of age, frail, and reluctant to participate in healthcare. As a collaborative team, myself, the clinical nurse consultant, the nurse unit manager and the team of doctors, we are creating Age Day, a clinic day once a month where between all of us, we should be able to see them all. My next goal is to do the other half. It's a big job. All of this, however, makes building a unique relationship with prisoners tricky. Over-familiarisation can lead to grooming. You really need to read Downing a Duck, an inmate's version. It's a fascinating story. There's a link in my script. Prisoners are often master manipulators and can sniff out a weakness and target that person. All nursing staff need to be aware of what they share with prisoners. In the health system, one often shares snippets of one's life. After all, this patient is going to go home and you're unlikely to meet them again. But in the prison sector, you are giving them ammunition to use against you. A correctional nurse can never forget where she is, her surroundings, and who she is with. Never turn your back on them. Never leave yourself exposed. You can still be a professional nurse and do your job well without being taken advantage of. That being said, I'm known as a care bear, which annoys some nurses. But the prisoners know I'm an honest person and that I will listen to them and I will act on their symptoms. I do not discriminate, I do not judge them, and they know this. There are many ways to protect yourself from becoming a victim. Understand that the manipulation game is in every facility, large or small. Always remain professional. Do not share personal information with incarcerated persons and be keenly aware of who is listening if you must discuss personal business at the facility. The tea room is just down the corridor. They can hear everything. Watch the incarcerated person and notice who is particularly interested in you. Always be firm, fair and consistent. Be comfortable with saying no. That's hard sometimes. And if you are asked to go against policy and procedures, inform someone. If you come across any problems or an unusual situation with a prisoner, ask for help. Make sure you document. Communicating with prisoners means using a variety of communication techniques, visual aids for those with literacy issues, talking in simple sentences and not baffling them with fancy words, treating them with respect and being honest in all dealings. We don't know their backstory. We don't know what got them in this jail in the first place. We don't know a lot about them and should not show any bias or judgment in dealing with them. My mum often says I'm good at peeling the onion, meaning I can get a story from almost anybody. Using effective questioning and active listening skills, I can elicit a story so as to help me treat the patient more effectively. My core nursing values have been honesty, empathy, compassion, understanding and helping others. That hasn't changed from when I worked in a hospital, a nursing home, in palliative care or in corrections. All nurses should have these qualities and should be far more understanding of our patients. I have collaborated with many nurses who take great delight in punishing the prisoners by withholding simple analgesia, ensuring medications are delayed, by making up stories against the prisoners to other staff, and overall encouraging poor care. Being a primary health nurse can also lead vulnerable nurses into practicing outside their scope. This is a dangerous pit to fall in as you are breaking the law, going against the standards and putting yourself at risk. Nursing standards are across the board and do not change just because we are in correctional nursing. Nurses need to think critically and analyse information regardless of the prisoner's crime. Engaging in a therapeutic and professional relationship with a prisoner is no different to nursing the free in a hospital setting. As said before, the correctional nurse needs to be responsible and accountable for ensuring that they are safe in their environment and safe when conducting patient assessments. Effective communication between nurse practitioners, visiting doctors and triaging appropriately is vitally important in obtaining care in a timely manner and ensures everybody needed for care is on the same page. When I am dealing with an unwell patient, I discuss with the patient the plan, what needs to be done, how we're going to do it, and what I hope the outcome will be. This will be as simple as a sore ear assessment, communicating clearly what I'm about to do, using the proper equipment, making my assessment, and informing a prescriber clearly. My core nursing values haven't changed. I'm still an honest, empathetic, caring person, advocating for my patients for the best health outcomes. These values ensure that I am clear in communicating with the team and ensuring everybody stays on the same page, so to speak. We do this by using an electronic handover form, having an aged and vulnerable spreadsheet, and by documenting clearly in the patient's file notes. At this point in time, we are still mostly paper-based, so ensuring my writing is legible is also vitally important. I don't believe much has changed in me since the start of my correctional career. I have learnt not to believe everything a patient says. and to focus on facts and observations I make during my assessments. Back in my hospital work days, even though I would question patients about, say, their pain levels, I would use effective questioning and patient education in helping them understand the pain scale and giving a more effective number. In corrections, prisoners often exaggerate their pain scales or suggest analgesia that would help them. So I continue to use effective questioning, patient education, and active listening to elicit a more truthful response. This, in turn, has built trust in the prisoners, and I now often hear their stories, good and bad. There is a friendship of sorts, although greatly modified. At the end of the day, I'm still the nurse I was 15 years ago. I'm thorough, honest, and compassionate. I have strong shoulders and a good listening ear, and I have learnt an ability to sift through information and find fact. I hope I have provided you with a little insight to me, myself and I, correctional nursing, and hopefully you'll get a glimpse of why I love it. Thanks for listening. Bye.